Hi, I'm Grace. I'm a vet nurse at the SPCA Wellington Centre. So working at the SPCA is quite different to working at a private practice. At the SPCA, we deal with a lot of stray animals, whereas in a private practice, you're solely based on client animals. As a vet nurse, we don't just assist the vet. My main responsibility is to ensure that all the animals within the centre are as comfortable as possible. It's really important to minimise fear and stress in the animals that are here because they're in a new environment. Some of them are injured, some of them have come from abusive situations. In my job, we do switch between roles each week. 1 week we'll be in hospital and the next on surgery and then assessment and then consult nurse. So it's very varied. In surgery, we admit patients, get everything ready, give the animals a check over, pre-medicate them, and then we monitor them closely under anaesthetic. So this dog is getting castrated and his hernia repaired, so I'm just shaving it and then giving it a wash to sterilise the site. We also work as the assessment nurse and we basically triage all the incoming animals. When an animal comes into the centre, we assess their behaviour, check them over, give them vaccination, flea and worming treatment. They get a good check over by the vet. And then we write down all the details about that animal, advertise them on Lost Pet, and then they're either taken down to hospital if they need vet treatment or they're taken to quarantine where they go for their 7-day stray hold. This is Rupert. So he's had one eye removed. He has also had another surgery on the other eye. He's been in our care for a couple of months and he is about to be adopted out. So hospital is where the animals come that need a little bit more care and medical treatment. When we're in charge of hospital, we come in and see what needs to be done first. We also have volunteers, so we need to assign them tasks, and then it's important to give the animals all their pain relief, get all the food ready for all the animals. We feed them, medicate them, we clean their litter trays, we clean up their cages, and then write down on the monitoring sheet everything so we can keep track of how they're going. And then throughout the day, as a hospital nurse, you're basically assisting the vets, doing whatever procedures and things need to be done in hospital, blood tests, cytology, urine tests as well. So we're one of the only SPCA centres that does have a private vet clinic, so we do private nurse consults as well. No day here is the same. You don't know what animals are going to come in and in what condition. 1 week I will be working 8 to 5 and the next 10 to 7. Some weeks we do work 7 days in a row and then the next week we'll do 3. It's definitely not just cuddling kittens and puppies. You do need to get your hands dirty. You're on your feet pretty much the whole day. There is a lot of cleaning involved, which can also include bodily fluids. You need to have good interpersonal skills because you will need to deal with the general public and obviously be comfortable working closely with animals. Oh my god. Puppies are very full on, aren't you? This job is definitely very emotionally draining. It can be really upsetting and heartbreaking seeing some of the animals that come into us. But all the nurses and the vets work super closely together. We're always there for each other. It's a really awesome team. To become a vet nurse, there is a certificate in veterinary nursing. From there, you can go on to do the diploma in veterinary nursing, which makes you fully qualified and much more likely to get a job in the industry having both of those qualifications. I've just been so passionate about animals for my whole life. It's so rewarding getting to work with animals every day and provide them with a temporary home and show them love and affection and everything they need. This is my perfect job.